Spine surgery is evolving, and 3D imaging is at the heart of the transformation. From sharper visuals to safer procedures, this technology is changing what's possible. In this video, I'll show you how 3D imaging is redefining spine surgery and why it could make a difference in your recovery. Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon. Every day, I see and I use 3D imaging software as well as navigation to improve outcomes in the operating room, making spine surgery faster, more precise, sometimes less invasive, and safer. If you want to stay up to date with breakthrough medical technologies, be sure to subscribe. Three-dimensional imaging takes a standard CT scan and reconstructs it into a lifelike, rotatable model of your spine. Surgeons can view your vertebra, the surrounding tissue from every angle, even before the first incision. It's like going from a map to a GPS with real-time visuals. Traditional X-rays and CT scans give only flat slices of the spine. This makes it harder to spot abnormalities, or it makes it more difficult for the brain to actually understand complex deformities. In contrast, a 3D image allows us to visualize the full anatomy of the spine in context, plan screws down to the millimeter, and hopefully reduce surgical surprises. So here's where three-dimensional imaging and navigation comes in. Before surgery, we create a full model to map out the safest approach. During surgery, we use image-guided tools that sync with that 3D scan, improving accuracy. After surgery, we review the outcomes and ensure that everything is aligned properly. This technology acts like a surgical GPS, helping guide tools and implants with extreme precision. For patients, the benefits can be real. For example, potentially smaller incisions, shorter surgery times, reduced blood loss, faster recovery, and potentially lower risk of complications. With 3D imaging, surgery that once required large opening in some hands can now be done in a minimally invasive manner with more confidence. I will say, keep in mind that 3D navigation is definitely not necessary. For example, I personally can perform the same minimally invasive lumbar spine fusion under fluoroscopy, which is essentially a poor man's X-ray machine in the operating room. But sometimes the 3D navigation will streamline my workflow, which makes the procedure faster and easier. Most surgeons can perform surgery either with 3D navigation or without, and there are pros and cons to each technique. 3D imaging can be especially powerful in spinal deformity cases like scoliosis, tumor resections that might be near sensitive nerves, potentially complex spine fusion procedures, especially if you've had a prior spine fusion in the past. It can help surgeons operate with confidence even in the most challenging of cases. 3D imaging is very safe. It uses the same base data as a standard CT scan, just with advanced reconstruction. Many hospitals now have it routinely for spine surgeries, and it's increasingly covered by insurance. But always check with your provider and your plan to confirm. 3D imaging is just the beginning. It's paving the way for robotic-assisted spine surgery, augmented reality in the operating room, and AI-driven predictive modeling. These are not science fiction. They are improving patient care today as we speak. So to recap, 3D imaging and navigation gives surgeons a clearer, fuller picture of your spine. It can make surgery more precise, less invasive, and sometimes safer. And it's shaping the future of personalized, high-tech spine care. If you found this helpful and are considering spine surgery, hit that like button and drop your questions and comments. Have you or someone you know experienced 3D guided surgery? I'd love to hear your story. And don't forget to subscribe for more insight on how medicine is changing for the better.